If you've had cancer surgery or radiation, you may have a body part that feels weak, stiff, or like it has been shrink-wrapped. The American Society of Clinical Oncology reports that up to 40% of our cancer survivors still complain of pain for years after their treatment. And that is not okay. Much of this pain is most likely related to scarring from surgery and fibrosis from radiation, which lead to changes in the skin and connective tissue, which then lead to the pain, weakness, tightness, and limited mobility. I'm cancer physical therapy specialist, Dr. Leslie Waltke. Welcome to this edition of the Recovery Room, where we're talking scar tissue and fibrosis, because really, what else would you rather be doing? Now, I would never compare the beautiful human body to a wad of gum or a piece of bread. However, I am now going to compare the human body to a wad of gum and a piece of bread. Go with me on this one. It's going to help illustrate a point. Now, let's imagine that this is your skin. In normal situations, it can lengthen and compress and bend without difficulty. Now, let's add in some scar tissue to our once mobile skin, and the scenario changes. Scar tissue does not lengthen or compress or bend well, which can lead to decreased mobility at any body part in that area. And then the nerve endings in there are going to get stuck and unhappy, causing discomfort and pain every time you move. Now let's imagine this is your connective tissue, which is the layer right underneath our skin. In normal situations, it too can lengthen and compress and bend without difficulty. Now we shall add in some radiation fibrosis, causing the connective tissue to thicken and harden, and then it too can cause limited mobility and cause discomfort and pain. So what does one do about scar tissue and fibrosis? Though the body can't fully eliminate scar tissue or fibrosis, the skin and connective tissue can be mobilized, softened, and stretched so it doesn't affect mobility or cause pain. And then the area is typically going to needs to be strengthened. If you are having problems, please don't live with it. Even if it has been years since your treatment, it is rarely too late to make it better. Talk with your primary or cancer doctor, navigator, or nurse about getting you to a physical therapist. Until then, watch the Recovery Room's upcoming video library on Facebook or YouTube for stretching videos to get you started. Now listen closely. Though pain and limitation can be common after surgery and radiation, that doesn't mean it's normal or should last. It is never okay to not be okay. I'm Dr. Leslie Waltke in the Recovery Room. We'll talk again soon.